I'm Dr. Bharat Sarkar. I'm a consultant spine surgeon at Department of Spine Surgery at Manipal Hospital, Whitefield, Bangalore. So common causes of back pain. Most common cause of back pain is a strain or sprain of muscles around the neck or back region. Other causes of back pain can be subdivided into following subheadings. Degenerative causes. It includes herniated discs, spinal canal stenosis, and spondylolisthesis. Inflammatory causes of back pain. Inflammatory conditions like ankylosing spondylitis, rheumatoid arthritis can lead to back pain. Infections of spine. Most common infection of spine in India is tuberculosis, followed by bacterial infections and fungal infections. Traumatic conditions of spine, osteoporosis of spine, and tumors of spine can also cause significant lower back pain or neck pain. When the lower back pain is not settling down with routine pain medications, physical therapy, and activity limitation, it is becoming significant. If the pain is becoming significant, we have to do further evaluation, imaging, and if required, intervention. So there are two types of situation. First, when we ask for immediate MRI. So conditions when the patient is presenting with back pain with history of cancers or history of infection or history of trauma, we ask for immediate MRI. Then, if the patient is presenting with weakness of the leg or bladder bowel dysfunction, we ask for immediate MRI. Situation 2, when we can take some time for asking for MRI, like degenerative conditions of spine, when we can wait for 15 days to 30 days before asking for MRI of the spine. For degenerative conditions, when the back pain is not settling down with activity limitation, physical therapy, and medications, the back pain surgery may be required. Or in certain conditions, when the spinal cord is pressed and causing weakness of the leg, bladder bowel dysfunctions, we do surgery immediately. So essentially there are three types of spine surgery. Number 1, decompression surgery. Number 2, fusion surgery. And number 3, decompression and fusion surgery. So there can be permutation combination of these surgeries to treat your back pain or neck pain. So to know what is degenerated disc disease, we should know what is a disc. Disc is a rubbery, cushiony and a hydrated material in between two bones of the vertebra. So when the disc becomes dehydrated, height gets reduced and it bulges, it is called as degenerated discs. And when this degenerated discs leads to back pain, leg pain or disability, this is called as degenerative disc disease. So spinal fusion is a well-established surgery in which two bones of the spine are fused together and the nerves are decompressed. So whenever there is instability of the spine along with the compression of the nerves that are symptomatic, then we need to perform this fusion surgery. Other than instability of the spine, fusion surgery is performed in traumatic conditions of spine, infections of spine, inflammatory conditions of spine, malignancies of spine, and also deformities of spine. In fusion surgery, what we do is we put 2 screws in each vertebra and fix them with a rod to make them a one bone, and we decompress the nerve. So there is a very little effect of the fusion surgery on the rest of the spine when we fuse single level or 2 levels of the spine. So the fusion surgeries of the neck does not affect neck mobility. Spinal canal stenosis is a degenerative disease of the spine where the spinal cord and the spinal nerves are pressed 360 degrees from the front by the degenerated discs and from behind by the arthritic facet joints. So the symptoms of spinal canal stenosis are back pain, leg pain, numbness in the legs, sometimes weakness of the legs and bladder bowel dysfunction. To understand laminectomy, we should know what is lamina first. Lamina is a part of spinal bones which covers the spinal cord and the nerves from behind. So this is model of a spine showing the 5 bones of the lumbar vertebra. 1, 2, 3, 4, 5. In between 2 bones, this is the disc in the front. If we rotate it, this structure from the behind which is covering the spinal cord is lamina, this part. So laminectomy is a surgery where we make a small window in the lamina to approach the compressed spine. During laminectomy, we remove all the structures which are compressing the nerves and we make the spinal nerves free. If the patient selection is good and if the laminectomy is performed properly, it has very little effect on the rest of the spine. So to understand what is herniated disc, we should know what is disc. I will repeat. So disc is a structure, gelatinous structure, which acts as a shock absorber, which gives stability and mobility to the spine. It is structure in between 2 vertebral bodies. So it has 2 components, outer fibrous and inner juicy gelatinous pulpus. So when this gelatinous part leaks through the fibrous region and this part enters the spinal canal, this is called as slip disc or disc herniation. So discectomy is a surgery when the herniated or the slipped fragment of the disc is removed from the spinal canal which was pressing the spinal nerve. And when do I need discectomy? 90% of the slipped discs or herniated disc can be managed without surgery by adequate rest, medications and physical therapy. And rest of the 10% patients, they do not get better with the conservative line of management, then they need discectomy surgery. When the normal natural disc is replaced by artificial disc in the cervical spine or in the lumbar spine, that is called as artificial disc replacement. Artificial disc replacement is very successful surgery in cervical spine disc diseases when above and below discs are normal, facets are normal, and when the patient is a young adult. So the risks can be subdivided into immediate risks and the delayed risks. Immediate risks involve excessive bleeding, injuries to the nerve, injury to the dura, spinal fluid leakage, and implant related risks. And one of the important risks is post-surgery paralysis. Implant related risks: loosening, breakage, infections, and need for revision spine surgery. If the patient selection is proper, if the imaging is done properly, and the pre-op planning is good, then the risk of spine surgery related complications are very less and negligible. Yes, it can happen, especially in cervical spine diseases. If the surgery is delayed, then the damages can be permanent in the form of spasticity of the legs, bladder bowel dysfunction, and paralysis. Yes, there will be some minimal pain after the surgery. So smaller surgeries like discectomies and laminectomies, the post-surgery pain is very minimal and can be managed by oral medications only. And in surgeries like fusion and decompression surgeries, then the pain has to be managed by intravenous analgesics. Also, post-surgery pain depends on the patient's pain tolerance and also the pre-operative pain counseling. Discectomies and decompression recovery time is maximum 10 days. Patient go back to work with limited restrictions. So non-surgical treatment of spine includes injection treatment, physical therapy, acupuncture and acupressures. We use various kind of injections like epidural injections, transforaminal epidural steroid injections, nerve root blocks, facet blocks and pars blocks depending upon the type of disorder. So following 3 things you should consider before choosing a spine surgeon. First, he should be doing exclusive spine work. Spine surgeon should be dedicating 100% of his practice to treat spine related disorders. Second, he should be a fellowship trained spine surgeon. Third and most important is patient should be comfortable with the surgeon. More than selecting a spine surgeon, you should know which surgeons to be avoided. First, those surgeons who are discouraging you from taking second opinion. Second, those who are interfering with decision making regarding spine surgery. And third, those surgeons who are bypassing conservative treatment and forcing you for spine surgeries directly. So choosing a spine center is again a very important question which comes to the patients. So spine surgeons don't work in isolation. So a good backup of neurology department, neuroradiology department, good ICU backup, anesthetists who are trained and well versed with various spine surgeries, good nurses who are trained in doing spine surgeries, and blood bank is very important before selecting a spine center.